Okay, turn around there.
Dese la vuelta. Dese la vuelta, doctor. Regrésese.
So you have trouble turning around?
Ajá. ¿Sí tiene?
Yeah.
Yes.
Yeah. Don't.
Respire, doctor, respire.
Relax and then try to.
Relájese y trate otra vez de caminar.
Yeah. Wow. Oh my goodness, he's jogging.
Yeah.
Oh my goodness. That's really good. That's really good. Now I want you to just stand in front of the fridge. Okay, so you're a very slow walker at this point.
Yes.
All right. Take one step forward away from the fridge. All right, so your left hip seizes up, does it?
Yes, it doesn't want to go.
It doesn't want to go. Okay, away you go now. That's it. Okay, Sarah, now just turn around and then come back this way. So the turning round seems to be your most difficult task.
Yes, it is.
This is day 4. You've blown us all away with how much you've improved. You must be very happy, eh?
Yes, excited.
I mean, okay, so let's see how easy it is for you to stand up and turn around on the spot. Real easy. Goodness me. And
Did
so
you want
you,
me to twirl?
so you can,
Fly.
so you can put that walker away now, real easy. A lot easier and quicker than you did before. There you go. Goodness me.
Done with that.
I usually use a walking stick.
Oh, you need your walking stick, do you? Okay.
It helps. Because I'm really seeing that.
Right.
I just kind of tried, even I got here and I tried yesterday, I couldn't do it.
Yep.
Until then I was cycling
Yep.
every morning for exercise,
Yep.
hiking and doing my push-ups.
Yep.
Which now I can't do.
Now turn around and come back to me. Okay, that's right. Turn back and go and sit down. I just want to see how you turned when you were asked quickly.
The problem now.
Yeah. So, best thing for... Okay, that's good. Do that again, that was good.
Yeah, man. You time?
You're just showing off now, aren't you?
Yeah. I couldn't do that before.
See, that's the test. If you put your hands on your head and walk, you have trouble hopping up and down out of a chair.
Yes.
Can you just stand up now and show me? Alright, so you've got to kick yourself a bit and your right hand's got the tremor. And your ankles, do they swell?
Yes, my ankles swell. My knees will also swell sometimes.
Your knees swell too. Do you have a pain around your kidney?
Yes,
Yeah,
on my right side.
Your right kidney?
Yes.
How long has it been since you've jogged?
Probably December-ish.
December. I'll just videotape you walking. Are your arms always bent like that?
When I get a little stressed or frustrated a little bit, more so.
Yep. Okay, so you're limping.
Yeah.
Why, you just explain to me why you're limping.
That left knee is sore.
Left knee is sore.
Pops and vines.
Okay, now, can I get you to walk fast to the door and tell me what it feels like? Alright, so you can't walk
Just difficult.
and you definitely wouldn't be able to jog to come back here?
No.
What would happen if you tried to jog?
I haven't got the balance.
Okay, we've got the balance. And, like, your arms are always bent like that, are they?
They are since this for the most part.
Okay, go and sit down there. Put your arms up in a jog fist position and jog up to the door here. Jog. Now back again. Go for it. Go for it. Want to do it again?
Can do.
Now that you're doing it, feels good, doesn't it?
It does.
Okay, back again. Now that's a simple little jog you couldn't do yesterday, could you?
No.
This is only day 2. But jog down to the mirrors down there and back again. Relax while you're doing it now.
They got a low door there, he has to duck.
You're so tall.
You what?
Alright, now would you have been able to do that on Sunday before I started treating you?
No.
So you're much better than...
Yes.
Yeah. You happy with it?
Yes. Very happy.
You got any advice for other people trying to make a decision about doing the 5-day program?
Definitely do it.
Definitely do it. Good on you, mate. My next 2 cases show severe spinal problems that would be easy for any practitioner to assume are impossible to overcome through natural means. It would also be easy for practitioners to assume that the symptoms each of these two patients were experiencing were caused by these severe spinal problems. However, the incredible improvement that both these patients experienced in just a matter of days, I believe, calls for close investigation. In my opinion, these two cases in particular warrant a chiropractic research team being established to take a close look at my treatment and the significant improvement it creates, even sometimes when severe spinal problems are present. Okay, Celeste, what's your full name and age?
Celeste Zampieri. I am 72 and a half years old.
72 and a half, and how long ago were you diagnosed with Parkinson's disease?
About 3 months ago.
And what hospital was that at?
Westmead.
Westmead Hospital.
Yeah.
Okay, now, Celeste, can you just stand up? You have to lean forward, mate. Lean. That's it. Righto. Do your best. Do your best. That's it. That's good. That's good. That's good. That's good. That's the way. Okay, so it's mainly your legs, isn't it? Yeah, legs and, yeah. Okay, that's good. Do you feel really good now?
I feel much better, yes.
Much better?
Much better.
Good on you, mate. All right, now let's see how well you stand up from the chair and walk now, hey?
Yeah, all right.
All right. Ah, mate. Nice long. Oh, mate, that's 100%. Righto, buddy. Come back. Come back and sit down. Don't forget, head and shoulders back. That's it. And nice. Oh, that's brilliant, mate. Good on you, buddy. Now I'd like to present one of the most outstanding success stories I've ever been involved with. When medical doctors see a kink in the spine of patients they're treating, their training tells them the only way to fix it is to surgically place a steel rod in their spine. After chiropractors do their best to make adjustments to see if such a kink will straighten, they too will consider giving advice about this steel rod surgery. And the reason is, after several years, the vertebra involved in such a kink begin to grow in the out of alignment kinked shape. In my new BA10 treatment approach, however, I work in a very unique way to program nerves to straighten the spine and reverse the abnormal shape of the kinked vertebra. When I used this technique on Barry Black, his spine straightened out in only 4 days, and his improvement was absolutely remarkable.
My name is Barry Black. I have had Parkinson's for 30 years. I have some difficulty walking and getting around and getting up.
Walk to me then, Barry.
Good day!
Righto, Barry, this is day 5. Take a walk down the end there.
Want me to run like yesterday?
Yeah, go on, go a bit faster if you want. You're getting a bit cocky now, mate. Right, away you go. Obviously you're very happy with the improvement, mate.
Yes, very happy, yes.
Very happy.
Yes.
Good on you, mate.
Sideways?
And you just sideways. Go on. Goodness me. I didn't know he was a bit of a smarty pants.
Backwards?
Backwards too, righto. Goodness me. Righto, we got everything this morning. Righto. Compared with Barry Black, my next client clearly shows the vast contrast that can exist between the causes of one patient with those of another, along with how desperately we need my new breed of BA10 health practitioner in the natural health system. Whilst Barry had a severe kink and several misalignments in his skeletal frame, my next client had next to no skeletal abnormalities, but he had severe problems with his throat, his spleen and his small intestine. This vast difference in causes that brings about virtually the same debilitating symptom end result can only be treated by a practitioner who is fully familiar with the functions of the immune system, all possible autoimmune disorder causal problems, and all the treatments necessary to overcome each individual patient's causal problems personal to them. My next client, Sebastian Quatra, came to me so malnourished that often his eyelids were closing as though he was falling asleep as I was talking to him. Sebastian, what age are you? What age? Sorry? 59. Did you sleep good here last night? You didn't sleep good. Do you normally sleep good at all?
No.
You don't? Alright. Did they ever find lesions in the test?
Start with you.
No lesions.
With the paperwork.
Sorry?
No brain.
In the brain or on the spinal cord? No lesions.
How do you pronounce his name?
That saddens me that you're not driven for yourself, for your own improvement. You've gone to a lot of trouble to come to me. So when I put my effort into to teach you my principles that really do work, you have to use them. I don't care how tired your body is. I don't,
I'm sorry for yesterday.
sorry?
I'm sorry for yesterday.
And who are you sorry to? Are you sorry to me or are you sorry to yourself? Right. The question is, when, how long ago did you come to the decision that it was no use putting effort into living anymore? Which is the light, which is the fan? See, the more he moves his limbs and his body in the chair, the easier it will be for him to do. See, even when he coughs, it's a very short cough because he's lost his lung expansion capabilities.
So have a pastry this week. See how you enjoy it. Good?
After we left yesterday, did you try to get this to your chest?
I tried.
You tried? How many times? Does that hurt? Help me. Help me. Pull.
Do this one since you worked this one.
It's hurting. Yeah. So you go against the pain.
That's the stiff one.
Go against the pain. Feel your leg relaxing against my arm. So I thought. Use your left hand to put that tissue on your right knee.
And she but then after he died and she was like alone. Then when they grew up and they also had to go out and work and all that, she started feeling good. The same whole thing. The same thing. And then this is another touch.
That's what you need to do again.
Teach. Yeah, I have to go.
Very good.
It's like
Seldom.
Now try to move the left wheel with your left arm.
They want to see the piece, they don't just go by the same pattern. If we get those chocolates,
Yes.
and got a tray.
Push with your left, not your right. stand up on your legs and push on the ground so you stand proud. You've got to walk to the wheelchair. Left foot first, yes. Stand strong and proud. 5 months of hard work to get your factory going. That's it, that's it. Nice big steps. Come on, you're a proud man. You've done a lot of stuff in your life. Now walk properly. Walk. Push up hard. Arms and legs. Arms first. Push up, push up. There you go, there you go. There you go. Push up, push up, push up. Arms and legs. Arms and legs. Push up. Stand nice and proud. That's really good. Shift your leg. Shift your leg. That's it. Now lean forward before you shift your right leg. Lean right forward. You've got to lean right forward. Put your arms forward if you're going to fall backwards. Put your arms forward. That's it. That's it. That's it.
Yeah.
That's it. That's it. Excellent, excellent, excellent. Excellent. That was a good one.
Yeah.
There you are walking. On your own, you're walking again.
Just like I was walking when, yeah.
So now you can see a future for yourself, can't you?
Such a fast
Now, watch how you sit when you bend instead of just falling backwards. See how you're bending?
You've got your hope and your faith back again, haven't you now? Yes?
Yes.
Excellent. You've seen your husband, how bad he was on day one, and now how good he's doing.
Yeah.
How do you feel about the 5 to 7 day treatment program?
It's wonderful. I have not seen anybody having this effect on him. He's gone to many mind control people, meditation camps, he's gone to the silver camp.
The Jose Silver.
We had one back in India.
You're his son?
Yes.
You've seen him do all these other treatments and they've
He's
been
always
really good?
been there
No,
with
that's
him.
not done.
You're happy
Not
with
as
this?
good, not as good as this.
Not as good as
He's
this.
not seen the effect of
You're happy
taking
with
as
the
a
treatment that I've given you over the last 12 days? Very, very, very happy. Now I'd like you to hear the words of an MS patient I treated, Darryl Clark, along with his wife, who made a very interesting observation on whether or not an MRI and lesions has anything at all to do with MS. This testimony, along with the documents I present on the absolute irrelevance of lesions on an MRI, makes me wonder why somebody hasn't confronted the leaders of the medical profession over this terrible blunder. There is absolutely no proof at all that Parkinson's disease and multiple sclerosis exist as incurable diseases, and somebody needs to confront them about this. before you came from Canada to here,
Yeah.
you would have felt pretty lost, not knowing what to expect.
It's a big step, huge step.
Yep.
There was a sense inside of me that this was the right thing to do.
Right.
And I appreciate everything. It was really taking a leap of faith.
Yeah, yeah.
I brought it to a couple of men at the church. One in particular said to me, anybody in the Bible that Jesus healed, it was a leap of faith that they had to take.
Yeah.
You know.
And when I did all my tests and asked all my questions, did you think that I was like digging in too deep into your life and your thoughts and stuff?
No, I welcomed it.
You did?
I welcomed it. It was something that needed to happen.
And then when I did my massage is definitely not a normal massage, is it? It's totally different.
Totally different. It has helped immensely.
Right.
Yeah, immensely.
Now, when I did the strengthening the mind to muscle connection, which is a problem in all Parkinson's MS patients, did you think that was a bit weird?
It was a bit difficult to get my head around initially.
Yeah.
But it made sense.
And it did help, didn't it?
It did, absolutely. Oh my gosh.
Yeah.
Absolutely.
And touching certain nerve trigger points while we do that treatment, it's very unique, isn't it? It's a unique approach. It's one of my secrets that I don't even write about in my books.
Yeah, no, absolutely. It's not something I've heard of anybody else ever talking about.
Yeah.
Yeah.
But you know, day one when you came here, you could think a thought to try and move your leg and it just wouldn't move, right?
Yeah, that's right.
And when we did this particular treatment, that changed that, didn't it?
It changes it, absolutely.
Yeah, yeah. And that's what's missing. Even in the natural therapy industry, as well as the medical profession, they don't acknowledge that there is an inability to get your thought to move your muscles when you want to move them. And there has to be something specific done, doesn't there? You know that now.
Yes.
In order to enable that.
Yeah, well, I mean, oftentimes you think that and you go, well, it's not happening, so where's the connection? What's missing?
Yeah.
And that
was what was missing.
That was what was missing.
Yeah, yeah. So now, how much improvement do you feel that you've got over this last 7 days of treatment?
I'd say conservatively, I'm 75% there.
75% there.
75% there, yeah. Because I can walk much better.
Yep.
My stamina has improved significantly.
Yep.
I can sleep better.
Yep.
Some by the way, are beyond 75%. So I would say my sleeping pattern.
The stomach pain?
The stomach pain is 95% there.
Right.
I get the odd little twinge.
Twinge every now and again.
Yeah, every now and again. But I mean, I was debilitated with it. So the only thing that they used to diagnose me was the brain lesions, the MRI.
Yeah.
It was the only thing that Dr. Bell used. In fact, when we went to see him this last January, a year later, didn't give me another MRI, didn't even ask me to walk, didn't check my pulse, didn't check my neck, zipped. He just sat there in the chair.
Yeah.
And what was interesting, I asked, why are we not doing another MRI? And I said, what if there's more lesions? And he says, sometimes more lesions doesn't have anything to do with the symptoms, so there would be no point. So my question was, okay, so the lesions aren't always associated with the mobility. So how can you diagnose somebody based on lesions when you're saying that doesn't interfere with mobility? So he was kind of contradicting himself.
Yeah.
We won't do another MRI because it won't make any difference, even if there's lesions, because they may not affect him. So
they may not have anything to do with
they may not.
The symptoms you're experiencing anyhow.
Right. So when Dr. Bell diagnosed me in September, end of September 2011, all the way till that, which was over a year had passed, he put a doom and gloom death sentence on me, which I did not accept at this level.
Yeah, but you did
at this level.
Yeah.
Because he's a doctor.
Yeah.
He's Dr. Bell.
Yeah.
But whatever it did, it sowed a seed in me.
Yeah.
Of hopelessness.
Yeah. Still, look, stop, 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 and stop. Yeah? Now, you don't need to do this. So you've got to relearn not to do that anymore. Watch my foot. It's really small movement. You only bend your knee a little bit. And do you know the reason that you fell that way? The reason is that you didn't go over and stand on top of your foot. You went like... Walk towards the unit there, mate. Just take your time.
My name is Ross Collins. I'm 46 years of age. I'm from Melbourne. I was diagnosed with Parkinson's disease in 1996. I was ultimately diagnosed by Professor Ed Byrne. He runs a private practice in Parkville, Ortiz.
Okay. Ross, now what I want to get you to do, mate, is I just want to get you walking, to get you on tape walking around the unit. Over to the door and back again will be fine, mate. Just take your time. You got an improvement already? I want you to see you walk. Just relax, let all your tensions go. That's good, mate. That's brilliant. That's brilliant. Now stand there and take stock. Feel free and love it. Enjoy the walk. Enjoy the walk. Okay. Okay, Ross, day 4, you've just had your second chiropractic appointment. How do you feel? Do you hate chiropractors now, mate?
No, I love them.
You good? You feel good?
Good.
You're looking straight. Yeah. All right, mate, let's go to the unit then, eh? Just relax, let it go, let everything go, and that's great, mate. That's really good.
I'm Tiffany Sakis, and I was admitted to a Gold Coast hospital just over a week ago. Unable to walk, couldn't move, and the doctors diagnosed me with MS at that point.
Now I'll just get you to stand up and walk over to the corner, over to the weights there, and turn around and then walk back to the seat, just on your own. That's it, without mum. Don't trip on that, that's it. Good girl.
No, I'm good today, I can walk.
Okay, so some days you have trouble walking?
Yeah.
Okay, that's good. Just take your time. Okay, and then just sit down there. Hey Tiffany, you here?
Yeah, certainly better than I was last time.
Oh, you're looking good, girl.
Thank you.
Yeah, that's
Feel
good.
better.
Your mum's looking good too, isn't she? Okay, now just for a comparison, I'll get you to walk over to that.
Sure.
Walk over that bench again. Like, hang on, take a walk over to that bench like you did last week.
I don't remember where I was last week. I was out of it last week.
You were out of it last week, weren't you?
Certainly
Look at you.
I can walk again. You can
Do you
talk.
feel normal? Do you feel like...
I do feel I'm probably 80% on what I was like. I'm almost there.
You're almost there. Get a bit dizzy and you start to tumble, you can hold onto the wall or the cart. Your right red leg sticking to the floor. Right. Right. There you go. So it's the turning around that you have trouble with, isn't it?
I'm going good as long as I keep it dry.
And now jog. How long has it been since you've been able to jog like that?
I don't even know. About a year.
Right.
Do it what?
Do it again and I'll count. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12 seconds. And the other one? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. You're just showing off now.
That's amazing.
Right.
That's pretty amazing.
Yeah. You weren't able to do that yesterday.
Or last week or last month. Or
Yeah.
I've
So
been
you
stumbling
walk.
on myself.
Jim's
Going
walking.
forward.
Jim's walking backwards, by the way.
Wait a minute. Hold it. Get this up.
Walking sideways. There we go. So there you go.
Look how he turned around. Look at this.
Yeah, very easily. Are you happy with what you've learned so far?
No.
He's ecstatic.
Yes, I am.
My name's Anita Marie Griffith. I come from Deloraine, Tasmania, and my diagnosing specialist was Helen Carsley.
Dr. Helen Carsley.
Yes, in Hobart, Tasmania, a neurologist.
It's made for people with foot drop. So you put that on your, it's attached to your shoelace?
Yes. When you lift,
Oh, I see.
it comes up.
So it's an elastic cord.
Yeah, it's a bungee cord.
And you've got a strap around your shoulders.
Yeah, that it anchors off.
Okay.
And it
Get it to come around. You're actually bringing the right leg around.
Yes.
Right.
Yeah.
Now, are you tired at the moment? Are you at your worst or your best, or what is
I'd
that?
say in between, in the middle.
About average.
Yeah.
All right. So as you get tired, does that get tighter? That gets worse.
That I bring it out even more,
Right.
and it starts to get really sore in here.
So I see you've got a walking stick.
Yeah.
Can you throw that out the window and not use it at all?
I have noticed with this foot, I'm starting to
drag your toes.
Drag my toes,
yeah.
And trip and.
Now on day one, you couldn't do that, could you? Lifting up to the next step.
No.
Could you?
No, I had to go
sideways.
Sideways
and one step at a time, right?
One step at a time.
Yeah. This is day 7. Anita's walking really comfortably now. Looks like she's pretty much walking normally. Really relaxed. You really look relaxed, you know that?
Sorry?
You really look relaxed.
Oh, do I?
Yeah.
I'd lost all hope. The doctors were telling me I'd be in a wheelchair soon, and that was already happening for long distances. I only walk about 5 metres before I was in pain.
Yep.
And was hardly going anywhere or doing anything. And the doctors don't give you any hope. You know, I had no options really as far as medication was concerned, and nothing was working. Doing this kind of course, I know, is a leap of faith. But because the doctors had given me no hope, I thought, well, I need to take this into my own hands. I need to do something. And I wanted control back of my health and my life. So I thought, no, I'm going to give it a go.
And you've now got that control back.
Yeah, and I've got that control back.
And the secrets of my treatment that I don't want you to discuss with people, they really work, don't they?
Oh, they do.
Yeah.
It's amazing. I can definitely see how much it's helped. You know, we walked down to the restaurant and back, which is, how far is that?
Oh, 500 metres? Been longer than that, wouldn't it?
Yeah, and I haven't walked that far.
Yeah.
In probably, gee, I don't know, 2 years probably.
Okay.
Yeah. That.
Tell me your name and the name of the neurologist who diagnosed you.
Steven Nikolovsky. I was diagnosed in June 2003. My neurologist is Professor McLennell.
What is your worst symptom?
Walking.
Walking problems. And tremors, you get tremors in your right leg, don't you, every now and again?
Yeah, right. They tend to
swap over.
Yes. Yeah, swap over.
Stephen, now just get you to walk over to those double doors over there and walk back again for me. Do what you did out near the car. Lift your frame up. That's alright, that was good. Go and open the door of the fridge. A lot of turning involved in that. Then close it. How many years has it been since you've had to rely on that walking frame?
At least 2.
At least 2. Okay. And here you haven't used the frame now for 3 days.
Yeah.
I mean, that's amazing stuff. So, how do you feel now after the 5 days?
It was very good.
Good one.
You enjoyed it?
You enjoyed it?
Yeah.
And you recommend it for others?
Yes.
Yep, good one. Okay, Mum?
Oh, now the pressure's on.
Nah, the pressure's not on. What do you reckon, Kate?
I just love your program. I think you've done wonders. I'm going to cry.
Are you?
Yeah. It's amazing stuff. I'm proud of Stephen. It's nice to know that it isn't a disease that's eating away at the myelin.
Yep.
Sorry. I'm just proud of Stephen. He's done a lot of hard work, but it's nice to know that your treatment does work.
Yeah.
I'm going to tell every MS patient
Yep.
that I know to come and visit you.
Good one.
In the last 5 years that we've had, you know, all the pain and suffering, it's the best thing we've really done.
Yep. Now, Herman,
yes.
You can't jog, can you?
No.
How long has it been since you've been...
I haven't been able to jog for the last 4.5 years.
At all?
At all.
And you have trouble walking up and down steps? You can't walk for very long?
Right, that's true.
All right.
So, turn around and go back.
Yep.
I'm like a robot because my leg was so stiff.
And you...
The evening of day 3, and I'm like, no, Dr. Baden, Uncle no. See this. I just came home from work and he's walked around the house, what?
5 times.
Okay, but, so that's 8. Look what he's doing with his legs. Anybody who thinks that this is a scam or chronic or it's not, it's real. It's very real. Mr. Batten is a special man with a special gift. And if you're open to healing and believe that you can get better.
I haven't been able to do this in 4.5 years. Haven't been able to turn around like this. Still got some practice, but normally when I would turn around like this, I'd be on the ground. So I feel good. So thank you, Noel. Thank you, Jody, for all that you guys are doing. Thank you guys very, very much. Squat down like this, and I can stay down here now for like a couple seconds or whatever. Then I can get up freely. Like even just from doing that, I can feel the blood circulating like through my legs.
And what is the name of this amazing man?
Noel Batten. Dr. Noel Batten, the naturopath from Australia. Good day, mate.
Yeah, he's a wonderful man.
Yep.
Before we turned up, how many times did you have to get up in the middle of the night to go to the toilet?
At least 2-3 times a night, easily.
And that was every night?
Yeah, every night.
And over the course of the 5 days we've been treating you, that stopped happening, hasn't it?
Yeah, I haven't had to go to the bathroom, which is great for me because it hasn't disrupted my sleep, so I've been able to get...
What have you got to say to other people who, like your wife, would be very sceptical about what I offer for treatment?
Watch the videos. What you see on the videos is the real deal.
It's the real deal.
It's no scam, no funny stuff. It's the real deal. I mean, it's real. It's real. That's all I can tell you. It's real.
I have to say, I used to be skeptical.
Come and sit down here. Sit down here.
No longer.
Sit down there.
This is for all of you. I understand. When it comes to the internet and the things that are on it, I'm skeptical.
Yeah.
Real big skeptic.
But it's okay. It's okay because we all are skeptical about certain
And you
things.
should be.
Then I started to read some of your book. I didn't complete it all, but I read a lot of it. And as you know from my library, I have a lot of holistic books, and I practice holistic medicine. So he knows what he's talking about.
Yeah.
He's knowledgeable. So there has to be something about him that's, will be able to help my husband.
He's not a quack, people.
So,
he's not a quack.
Well, he's a wonderful man. He's like family now. No,
he's a nice guy anyhow.
He's my Uncle No.
I first started off when I first got diagnosed with MS. I got all the mercury fillings removed out of my teeth.
Did that help?
No, nothing significant at all. I feel like my body actually gone into shock.
Right.
And after that,
I
changed my diet, high protein, low carbohydrates, minimal sugar. And I did that, and it felt like that was working for a while, but still no significant change. None. I was going physical therapy and doing this and doing that and exercising, and still nothing was working. So I was like, okay, I have to find something. And then that's when I received the email from whoever that person was to tell me about you. So I watched all your videos 3, 4, 5 times over and over again, and I was like, okay, I have to try, I have to trust. And like I said, when I saw your videos, I saw a lot of myself in each individual in the videos, and I was like, okay, I got to try it. And I called you, and I just knew.
You knew that it was going to work. Excellent, excellent. Since the advent of the internet, diagnostic information about Parkinson's disease and multiple sclerosis is being shared abundantly, and people are starting to learn the truth that lesions showing on an MRI is in no way a sign that a person has either of these two diseases. In fact, around 50% of the Parkinson's and MS patients who have attended my 5-day treatment program who have had an MRI have explained that they had no lesions showing on their MRI. Here are several Parkinson's and MS patients who will confirm this to you. What is the name of the neurologist who carried out your diagnosis?
Pedro Guajardo. He's in Monterrey, Mexico.
Now, did he do an MRI on you?
Yes, he did.
Did he find lesions?
No, he didn't see anything abnormal.
Nothing abnormal on your MRI?
Nothing abnormal.
So then how did he arrive at the conclusion that you have Parkinson's disease?
He asked me to do a couple of things, like to walk, and he saw my face. He concluded that because of the symptoms he was...
From the symptoms, right.
Yes.
Can you just say your name?
Richard Osprey.
Where do you come from?
Currently living in Huntsville, Alabama.
What have you been diagnosed with?
Parkinson's.
And what is the name of the neurologist who carried out that diagnosis?
Dr. Watts.
And did he do an MRI?
The previous doctor before him had done an MRI.
And did they find lesions?
No.
No lesions at all?
No lesions at all.
Could you tell me your full name? Where do you live?
Toronto, Canada.
How long have you been in the wheelchair?
2 years.
What is the name of the neurologist who carried out your diagnosis?
Dr. Lee.
Did he do an MRI to see if you had lesions?
He took one MRI when I was diagnosed.
That time in 2008, no lesion in the brain.
Your first MRI and you had no lesions?
No. No.
How bad were you at that stage?
Like she was walking like
holding balls.
Holding balls or with a cane.
Right.
Then they did another MRI in May.
Then they found lesion in the brain.
Many lesions?
No. There is a lesion.
There is a lesion.
And he took another MRI, still lesions increasing.
Were you in a wheelchair at that stage?
Yes.
Yeah. He took another MRI in January this year, 2010, but it was stable.
There was no lesions?
No lesion at all.
Not one lesion?
No.
Okay, so now, are you able to stand up on your legs and hold your body weight standing? No. You can't?
My name is Alba Galeano. I am 66 years old.
And you live in Brooklyn?
Yes.
And you were diagnosed with Parkinson's disease?
April 16, 2009. A general practitioner, his name is Albert Rosso.
Okay. And your neurologist?
Dr. Balderrama.
And where is he from?
Manhattan.
Manhattan, okay.
Yes.
Did either of them do an MRI that showed lesions? Where is that MRI? Here.
It's over there. There is a...
It states here, no bony destructive lesion is appreciated. No evidence of intracranial mass effect in this patient with tremors. This is a radiology report, East Manhattan Diagnostic Imaging.
Yes.
Here are some videos now of Parkinson's and MS patients who testify their neurologist didn't even request an MRI to look for lesions, that they made a diagnosis by observing their stiffness and other symptoms that are assumed to be associated with these two, in my opinion, imaginary diseases.
Suzanne Jane Louis. I'm 63.
Yep.
I've been diagnosed with Parkinson's since 2010. I live in Newcastle, Australia.
Yep. What was the name of the neurologist who carried out the diagnosis?
Initially I went to Dr. Catacar's rooms.
Was there an MRI done?
No.
So they didn't look for lesions?
No.
So they just observed your symptoms and came to the conclusion you had Parkinson's?
That's right.
All right. And what was the name of the neurologist who carried out that diagnosis?
Jenny, would you ever live
Dr. Elkis.
Dr. Elkis.
Dr. Elkis?
Yeah.
South Michigan.
How do you spell that? Elkis? Did he do an MRI?
No.
No, he did
So
not.
he
watched me walk, he watched me.
So he just made the diagnosis on observation of symptoms.
Right.
Yeah.
And you and I both know that those same symptoms that you have can be experienced by the average person who comes in off the street with really tight muscular system due to ongoing stress. Correct?
Yeah.
A person can even have numbness and tingling down the side of the face because of really tight neck muscles and a misaligned C1 or C2, correct?
That's why you can find TMJ involved on one side or the other.
Diagnosed with Parkinson's when?
Approximately last April, 2011.
April, okay, right.
So I was in having a physical, and I asked the doctor about it, and he recommended a neurologist.
Yep. Yep.
And so
right.
I didn't care much for his test, and he walked down the hall, and
yep.
And then he says, "That's what you have. Let's start you on medication."
So there was no MRI done?
No.
Okay. This is the 9th day of my Travel to Treat program with you. You know, you guys have been so good to work with. First of all, I would like to get your feedback on what this experience has been like for you.
Well, for me personally, it was quite an experience. It was like challenge for the brain. I was not understanding things the way I needed to interpret it, and so that was my challenge.
Right. And the fact that I helped you understand how to deal with the world outside the house, and you're thinking about a goal setting and things in the world, it's not sort of subjects you would think would be associated with MS, were they?
No.
Michael, you're a qualified chiropractor. There's your qualifications there from Palmer. Working with me for the betterment of your wife, what do you feel about the program? How do you like my treatment program?
It's one of a kind. It's like it teaches you not only the massage that you do, but it's the mind work. You don't see that anywhere where you get into the cause, and it's all about, it's all about working on the brain, and no one's doing that. No one's doing that.
No one's doing it. No.
You're the only one.
Yeah.
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 I mean, her doctor did a little bit of it, but you're teaching us all this stuff.
Yep.
You're teaching us how to be, it's like an instruction manual for the mind.
Right.
That's what it is.
Right.
Yeah.
Right.
It's an instruction manual for the mind. No, if you go anywhere else, I think you'll be wasting your money. You're dead on. You know exactly what to do.
Yeah. So if they go anywhere else, if they've got MS and Parkinson's,
they're wasting their money.
They're wasting it. They need to come to me, right?
Yeah, they have to come to you.
Thanks,
yeah.
mate.
Yeah, seriously.
Yeah. So as a chiropractor,
did
you learn stuff off me that's going to help you in your chiropractic?
Oh yeah, definitely.
Excellent.
Yeah.
Righto, Jim. Day 5. This is the end of the treatment. How do you feel?
Absolutely fantastic.
Good. And you're certainly not sorry you came to do the program? Not at all.
No, should have found you 30 years ago.
There you go. That's excellent, mate. Have you got any descriptions of how you improve? This little interview on camera is to encourage other people.
Well, if you want to feel better with life, I suggest come and see you.
Right.
I don't know how I can put it any plainer.
Right.
I mean, I can't remember. Probably I'd have to go back 25 years to say that I felt as good as I feel now, and then I might be exaggerating. See, I might have to go back 35 years even.
Goodness. So you feel that much better?
I feel that much better.
Right. And as a Christian, you would probably respect the fact that the 6 steps of treatment that I use actually come from the Bible. Yeah. So that's good, isn't it? Yeah.
Fantastic.
All right, mate. Thank you very much for travelling all the way from down there in Broken Hill. Thank you very much.
No.
Now, Trudy, we're on day 5 of the treatment. You didn't have any obvious symptoms for us to film a before video. Tell me your name and the name of the neurologist who carried out your diagnosis.
My name is Trudy Penman, and I was diagnosed originally by Rick Adams at Southport and verified by John O'Sullivan in Brisbane.
And they're both neurologists?
Both neurologists.
All right. You're going home in a couple of hours. How do you feel about what we've done?
I feel like I've got a new life.
You feel like you've got a new life?
Yeah.
She's a new woman.
Yeah, all right. And you feel a lot better now than when you first turned up?
I do.
Okay. Now, Mark, as Trudy's husband, you've seen her develop the symptoms, and how do you feel about the 5 days?
This morning it really hit home to see the back so straight.
Yeah.
After Monday when it was just like the big curve.
Yeah.
And then this morning it was just straight as, I just couldn't believe it.
Yeah, it's good, isn't it?
And and even this morning when she does that, her finger's a lot better, a lot faster than it was previous to this week.
Yeah. Alright guys, thanks for coming.
Before we end the video, Trudy's done a poem up and I wanted to read it while we're on camera.
Okay, wow.
It's a long one. It was December 2007 when at 38 I was diagnosed with Parkinson's. Mark and I were devastated beyond belief, so to the internet we searched for relief. The biggest medical blunder was what caught our attention, so we made contact with Noel Batten and Warmerin. Noel, who was in America doing treatment, sent us a DVD of his successful clients. To neurologists and doctors we did see many different drugs we were given with glee. The tremors and rigidity were still present, now with nausea and sleep absent. I showed the DVD to the doctors and chiropractors who said it was not a medical blunder. When contacted by Noel in July this year, the next available time was September, oh dear. The 8th to the 12th of September is a week which I will always remember. We left our 3 kids with family at home, and from Wollongbar to Warmerin we did roam. A week we spent with Noel and Kevin. Massage, chiropractors and counselling, it felt like heaven. You taught me to love myself and smile, to be happy and know my stress and traumas are gone a mile. Now I can relax and enjoy my new life, be a loving person to my family and children and a sexy wife. Noel, you need to know I feel blessed to have met you. Thank you for what you do.
Thank you so much for putting all that time into that. That was excellent. Thank you very much. Goodness me. You surprised me, girl.